Hello, this is Miss Regina again, and welcome back to Break the Sickle Cycle Initiative. On today's episode, we are still talking about the symptoms of the sickle cell disease, and we will further talk about how the sickle cell disease is diagnosed. The next symptom I would like to talk about is vision impairment. The sickle red blood cells can obstruct the vessels which supply the retina with blood. Retina is an anterior lining of the eye which transmits visual information to the brain. So when the retina is damaged, the individual can have blurred vision, double vision, or even blindness. The next is shortness of breath. When there is inadequate oxygen supply due to anemia, it leads to respiratory distress. Again, individuals with the sickle cell disease have a pale skin due to the anemia, and there is blood in urine as well. So individuals with the sickle cell disease are prone to bleeding, which can result in stain of blood in their urine. The last symptom I would like to talk about is risk to cerebrovascular accidents, or in other words, stroke. Stroke occurs when blood flow to the brain is interrupted due to blockage or rupture. Sickle red blood cells has the tendency of blocking the vessels which supply the brain with blood, and these can predispose the individual to stroke. Now, to how the sickle cell disease is diagnosed. I have divided the diagnosis into 4 major groups. We have blood tests, we have genetics, we have physical examination, and lastly, we have other tests that we do as well. Under the blood test, we have 3 tests that you can do to ascertain that individual has the sickle cell disease or not. The first one is the complete blood count. Complete blood count measures the various components of the blood, that is the red blood cell, the white blood cells, and the platelets. It can also be used to detect if individual has anemia or not. The next one is sickling test. Sickling test is also done to detect if the individual has the sickling hemoglobin. And lastly, we have the electrophoresis. The electrophoresis can also be used to determine an abnormal hemoglobin in the blood. And under the genetics, we can also do DNA analysis to detect the mutation of hemoglobin B gene, which is responsible for the condition. And we have the physical examination. Physical examination like palpation of the liver, the spleen. We earlier on said that we are going to have splenomegaly and hepatomegaly. So physical examination such as palpation of these organs can help us to detect the condition. And if you exhibit symptoms of anemia, we can also use it as a diagnostic tool. And lastly, the other test, we have bone marrow aspiration. Bone marrow is responsible for the production of red blood cells. So we can aspirate the content of the bone marrow to detect the type of red blood cell the bone marrow produces. We also have the liver function test and the renal function test. These tests are used to ascertain if these organs are functioning properly as it's supposed to be. These are the diagnostic tools or the diagnostic investigations that we can use to detect if someone has a sickle cell disease. This brings us to the end of today's presentation. In our next episode, we are going to be vividly talking about the almighty sickle cell crisis, and we are going to have a sickle cell warrior who is going to share his or her experience with the sickle cell crisis. Don't miss out on this episode. Thank you.